Goeiemôre, u is ingeskakel op Radio Gamkaland 87.6 FM met my Euna, baie spesiale program vanoggend. As u net ingeskakel is, kan u saam met ons praat. Die nommer is 32805 met die woordjie Gamka voor, slegs R1, of u kan inbel 023 415 2010. Saam my in die ateljee ek vanoggend baie belangrike gaste, very important, they from Lesotho. Yeah, from very far. And then now, I think some of you can remember once I had an interview with a very, very passionate woman from Cape Town, from PSH. Yes, I know, yeah, I hear you say PSH, Patsy the Lora. She's in the house today, and she's be with guests from abroad, and they are today. It's a very remarkable day. Guess what? It's the day prior Women's Month, or the official day of Women's Day. Tomorrow is the 9th. So, as women, later we will hear from their hearts what is the message that they will leave for us in Beaufort West. But first of all, let's cover the business, why they are here. Good morning, Patsy, and all my guests. A very warm Beaufort West welcome to you.
Thank you, Euna. Yeah, it's indeed a pleasure again to be here. And to the listeners, good morning. Yes, indeed, it's a very remarkable day for partners in sexual health. For those that do not know, we are an organization that focuses on sexual reproductive health, very much towards and in line with youth activities. So today we are pre-launching our official partnership with the International Planned Parenthood Federation. And I thought it's important for us to share the information, and so that people for future reference will know if we talk about IPPF, who they are, what they do, and how do we as partners in sexual health fit into the bigger picture of the work that we will do collaboratively. So yeah, I want to introduce to you Dr. Hanson. She's from Lesotho, as you have mentioned. And then additional to that, we have a guest, Dudu Simelane. She is based in the Nairobi office in Kenya, in the IPPF African region. So yeah, this is the two important people that's actually visiting PSH, launching our partnership here in Beaufort West. We just came from our offices, and I think they've been inspired to see the work that we're doing in Beaufort West area in the Central Karoo with the youth. Yeah, so.
Yeah, but I also mentioned, yes, a shadow guest being with us as women within the studio. So, sir, can you please introduce yourself, and then we off then, and I'll talk to our guest. First of all, maybe to the doctor, but first, sir, can you please introduce yourself?
Wow, thanks for this great opportunity. And honestly speaking, I'm here to spice the ladies.
Okay. Yes.
My name is Simelane. I'm the clinical manager for partners in sexual health. I'm the grassroots man.
Hey, I like that. Where's all the men? So, what a great opportunity that we have this morning to have you in Beaufort West. It's a bit cold, but I believe your hearts, the warmth of our presence make it very, very easy for you. But first of all, Dudu, can you just talk about what you are doing here today in Beaufort West?
Okay, thank you, Euna. As I've been introduced, I'm Dudu Simelane. I work for the IPPF Africa Regional Office in Nairobi, and we are here in the Cape because we are starting a partnership with the partners in sexual health. So we are here meeting the partners of PSH, but also those meetings and activities are leading up to the launch of the partnership between IPPF Africa region and PSH tomorrow, and where we will also launch a youth-friendly clinic. So that's why we are here.
Okay, first of all, before I'm going to Dr. Patsy, I think you gave birth to PSH. Will you please tell us what is the mandate and the objective of you, because you talk about youth activities, youth friendly and what. Can you explain to our listeners, and we are also tuned in worldwide, www.gamkafm.ndstream.net. If you far from our boundaries, you can might as well send us an SMS just to talk about or to talk with us what you think about this program. But Patsy, the objective of PSH.
Yeah, thank you, Dudu. Partners in sexual health derive from a huge need and gap in terms of sexual reproductive health and rights services and linked to evidence. So our objectives of the organization is very in line with research-based evidence in terms of our projects. Majority of the projects that we're implementing in the Western Cape have an attachment of an impact assessment or a research study that ensure that we actually follow the current trends and the current needs. I will not say so easily, but sometimes I think people forget the importance of having evidence in terms of what we do and what impact our projects is. And then also we sometimes tend to think that this is a need for the community, and then at the later stage actually realize there's a different need or you need to make a different approach. So the key objective of the organization to provide sexual reproductive health services specifically to our young people. However, our mission and vision includes all women and all men, but as I said, specifically the youth of South Africa. So we have a variety of projects that we deal with sexual reproductive health, SRHR. In South Africa, maybe just to name, we have non-medical sites. We provide HIV counseling and testing. We have a teen parenting program where we support and counsel our teen parents and support them. We have a Truckers project where we deal with the men specifically. We have a victim empowerment project that we deal with gender-based violence, intimate partner violence. We have in-school youth project. We have an out-of-school youth project. We have also deal with sex workers, whereby we educate them, support them. And then last but not least, we're now adding on to our victim support services, where we're going to provide almost like kits, support kits, where you make up almost like the things we buy, soap and the face cloth and toothbrush for some of our support for victims of sexual violence, very much geared towards the youth. So we are, in a nutshell, it's quite a variety of projects. And last but not least, then we have our youth clinic, where we provide family planning and family planning services and support to all our youth. We are catering for a specific age group, so it's a very youth-friendly clinic. And then we are planning to exactly take these services that we've been doing this now for the past 3 years in Beaufort West, and I think we've learned quite a lot of lessons. So what we will do is we will try to take these services over now to the Eastern Cape, where we're launching our new clinic in Burgersdorp, Eastern Cape, and exactly try to replicate best practices, what we've learned here and implemented now in the Eastern Cape.
Thank you. Dr. Hanson, you here in Beaufort West for the day, I believe, or for the launch and relaunch. So what is on your heart today?
Thank you very much, Euna, for inviting us to come and talk to your listeners. I am Dr. Phiny Hanson. As indicated in the introductions, I come from Lesotho. However, I'm here representing the leadership in our IPPF Africa Region Office in Nairobi. With me is Dudu, who will explain further the intent of our visit. However, I am very excited. Earlier on, we met both the local municipality authorities and the youth, and also the service providers at the Beaufort West Clinic. And I have been very, very, very much impressed about the passion which has been demonstrated by the people of Beaufort West in delivering sexual reproductive health services in our region here. And not only the commitment demonstrated by the workers, but the support also demonstrated by the local authorities, because that is one of the key strategies that IPPF would like the respective countries or authorities in Africa to embrace, to own the services that are provided in addressing the key health issues in the Africa region, but not only in Africa but globally. Dudu, maybe you can elaborate a little bit more before I can go on and talk about my role related to the upcoming launch tomorrow.
Okay, thank you. IPPF, as has been indicated by Dr. Hanson, we are a network of national organizations globally in over 180 countries, and just over 40 of those are in Africa. So we work with national organizations which are locally led, locally managed, and locally governed to deliver integrated sexual and reproductive health services. And those services would be integrated with HIV and other broader health services, depending on the choice of the member organization and their capacity, and of course linked to national health priorities. So that's what IPPF is and what we do. But also we advocate for a conducive policy environment for the provision of these services with national governments, but also our advocacy is also at regional and global levels. As you will appreciate that we have headquarters in London, so there are some global engagements at the policy level, at the global level, but also, as indicated, we represent the Africa region, and there are some regional advocacy programs and initiatives that we also engage in, and that's just in a nutshell in terms of what we do. So that's it in terms of our work.
Yeah, so what is your plan from here? Patsy, can you answer there? Your plans from here?
Sorry, as from where we are at this moment in time, after we've actually finished here, we are planning to have just a quick meeting, and then we're off to the Eastern Cape, where we will be launching tomorrow our youth clinic and the services in partnership with IPPF, and it's going to be a huge event. I think the Eastern Cape is very excited for us bringing this type of services to the rural of the rural. I think people can agree with me that there is not a lot of sexual reproductive health services specifically geared to our youth in rural communities. And I think that's one of the key things that PSH is very much focused on. So we focus very much on rural communities and try to deliver service that is usually not easily and accessibly available to our youth. Yeah, so tomorrow we're launching our offices and then the National Departments of Social Development, UNFPA, quite a key, a lot of people is coming and attending our launch tomorrow in Burgersdorp.
Yeah, and Doc, I also believe you believe in partnering integration. So maybe other people is now tuned in and they want to be part of this or the IPPF. What can they do to be partnering with you or your organizations?
Thank you very much. As Dudu has indicated, IPPF has a presence in about 44 countries in Africa, besides also being present in other 6 regions globally. South Africa, we are collaborating with PSH, and that's the only key partner that we currently have in the in the Eastern and Western Cape. We have another partner in the Gauteng province who is focusing mainly on advocacy issues, while partners in sexual health are focusing on issues around service delivery. What we envisage going forward, or what we have been discussing with the Western Cape authorities, is that we should have a formal partnership with government and with partners in sexual health to ensure that sexual reproductive health issues are also prioritized, not only in the health sector but even by other sectors such as the Department of Social Development. And also central to that, the way IPPF works in other countries is that we work through a voluntary or volunteers drive where people who are recipients of these services are also part of the governing structures of the work that we are doing. If eventually partners in sexual health do graduate to a higher level, for instance, in other countries, we have full member associations who are affiliated to IPPF. And we are working with partners in sexual health that they should gradually build up their structures so that they reach that status. And at that point, we suggest that the board, the governing board of the member association, should be volunteers. And volunteers, there's a mixture of professionals, but 30% of those volunteers should be youth. We have a criteria, an age limit when we're talking about youth. And these youth have their own programs that they have designed in line with, of course, the policies and strategic direction of IPPF. And the youth, as part of the governing board, they have representation and a voice. And whatever programs we have, they are designed by the youth. And eventually, if PSH grows to that level, we expect the community to be central to whatever decisions are made. I hope that has answered.
Yes. So, Dudu, it's August month, the month of women. What message do you have for us in the Central Karoo region?
Yes, it is Women's Month in South Africa, and perhaps I could take the opportunity to wish women a happy Women's Day in advance of tomorrow. But in terms of messaging, I think for me, I would direct my message to the local authorities and even national government to say, if we are to advance the goals of sexual and reproductive health, and as IPPF, which we have placed very centrally to our business, we need our governments to commit to invest in women, and investing in women, in women's health in particular, because we are talking health issues in this program, but also in women's empowerment, in women's education, because it is those empowered women who are able to make the right decisions related to their sexual and reproductive health and their health in general. So that would be my message, that would be my plea, and I think all of us, we would embrace that message to say investing in women and girls, particularly young women, and it is very important, and it's very central to our core business as IPPF.
Yes. Patsy, our young women, what message do you give to them?
I think it's important. I think the key for partners in sexual health, and one of the projects that I didn't mention that we are doing is empowering and developing our young women to become leaders in the sense of advocating on different levels on sexual reproductive health. Sorry, and the inclusion, of course. To start considering and noticing the role that our young woman plays in a variety of different levels of policy making. So yeah, as is tomorrow is Women's Day, PSH is planning. We're not just going to focus tomorrow on Women's Day. Our quarter within the organization is based, on women's quarter. We call it the Women's Quarter in part and sexual health. So for the next 3 months, we're focusing on young women's and women's issues. For inclusion, we will focus on breast cancer. We will focus on cervical cancer. September month is cervical cancer month. October is breast cancer month. So as of this month and the next 2 months to come, we will our services will be very much more geared towards serving our young women, specifically in relation with services that we deliver within the framework of sexual reproductive health. So the listeners can keep the ears out. I think Juanita will ensure that we make sure that our people, specifically in Beaufort West area, are informed about the services we're planning to have. We're going to have a strong focus on cervical cancer, which is a topic or a service that is not highlighted or doesn't get the attention it actually deserves in South Africa. So that's one of the key things that PSH will drive for, specifically for our young women, so that we can inform them about cervical cancer. Dit is nou natuurlijk cervicale kanker, dames en heren. Laat ek 'n bietjie oor aan Afrikaans toe. Euna het my gevra ek moet 'n bietjie Afrikaans praat. So ja, ons gaan definitief fokus op daai twee activiteite. Dit is op borskanker en cervicale kanker. En ons sal definitief vir die luisteraars laat weet wanneer ons spesifiek services gaan bedien aan ons gemeenskappe. En ons sal seker maak dat dit opgeplak word by relevante informasiesentrums, sodat ons jong mense asseblief tog moet kom en gebruik maak van ons services. En ek dink die belangrikste wat ek kan sê vir ons jong mense en ons jong vrouens en ons vrouens is dat ons seksuele en reproductive health, ek is baie jammer, is absoluut van kardinale belang. Ons moet begin kyk na onsself. Dankie.
Ja, Doc, it's August month in Beaufort West, I think in South Africa. So what message do you give to us?
I would just like to pick up on what Patsy has said. Usually we intend to work towards celebrating one day, but my message would be, let's not do that. It should be a build-up of activities that as we celebrate Women's Day, we should be demonstrating what has been happening since last year, August.
Yeah.
And then we would be displaying that these have been our achievements, so that we have global targets. We have committed globally that by 2015, these are the milestones we will have achieved. So every year we should be demonstrating what we have been doing towards achieving the set goals for the Millennium Development Goals. And if you allow me to say just one very, very important message, that now IPPF is working with the member associations to deliver and to obtain commitment from all individuals globally, is that we are working on targets beyond 2015. We have actually come up with a declaration or a strategy on Vision 2020, where we would we are urging member governments to engage with organizations and individuals to sign up for the declaration and to commit that we want to put sexual reproductive health at the center of the Millennium Development Goals. We have about 10 commitments where we are saying governments should establish that by 2015 a new international development framework that includes sexual reproductive health and rights should be integrated into the development agenda. We should also, as governments, increase access to sexual and reproductive health and rights services in order to close the gap between the top and the bottom wealth quantiles. That's the communities that are at the top and the bottom. Let's close that gap and eliminate all forms of discrimination against women and girls. And the fourth commitment that we urge governments to sign up to is to recognize sexual rights and reproductive rights as human rights by the year 2020 and engage young people in all policy decisions, as I have earlier indicated, and provide comprehensive and integrated sexual and reproductive health and HIV services within public and private and non-for-profit health systems by 2020. And the seventh commitment is that we should reduce by at least 50% the current unmet need for family planning. And the eighth commitment is to make comprehensive sexual education available to all. And ninth one is to reduce maternal mortality due to unsafe abortion by 75%. And the last but not least is to urge governments to allocate sufficient resources, as my colleague Dudu mentioned.
So that is the 10 commandments for
the 10 commandments that we are saying. There's a link that IPPF has been circulating to all its partners globally, where each individual who wants to subscribe to these commitments can sign up to. Sure. And we expect that PSH will also be circulating these declaration forms for everybody to sign up. We remind me again, Dudu, how many signatures we are expecting?
Yes, we are expecting 1 million signatures to sign up to the campaign I Decide, which Dr. Phiny has talked about. And these signatures will be presented at the UN General Assembly this coming September. So if we all sign up, if in our great numbers, this will be a clear message to the decision makers at the global level that indeed reproductive health, sexual and reproductive health and rights must continue to be at the top of the agenda, even in the post-2015 period. Thank you.
And on that note, we say amen to that. And we finish now. Anyone you want to greet before we are off air?
Yes, thank you, listeners. Thank you for listening. I hope it was informative. And as I said, the reason for us being here is just for us to let the listeners and the people out here in Beaufort West area and the Central Karoo know the services that we are providing to our communities on a very local level, and hopeful to broaden our scope to the much needed people and specifically our youth out there. So thank you for listening.